Just a couple of words from me before I hand over to Lois Beach, our consultancy and partnerships manager. This happy hour follows an earlier happy hour that we ran back on the 28th of October, where we started looking at different elements of market engagement around supported housing, and we recognise that supported housing plays a valuable and really important accommodation choice for older people and working age adults with long-term conditions. And that's why we're putting the spotlight today on the Supported Housing Regulatory Oversight Act. And Lois will share with you our programme and why this is really of value. But also, I just wanted to say that over the last few weeks, it's also been recognised nationally that supported housing plays a really important role. This year's HAPPI Design Award winner was a scheme in Bath and North East Somerset, and only last week Elizabeth Close Elam's housing scheme in South Gloucestershire and Bristol, a partnership with Bristol City Council and South Gloss Council, won the best supported housing. We know it provides a really valuable choice. There are examples of really great practice, and you're going to learn a lot more of practice both nationally and locally today. So Lois, I'm going to hand over to you.
Brilliant. Thanks, Jeremy. And yeah, really good afternoon, everyone. Thanks so much for joining us. As Jeremy said, I'm Louise Beach. I am the consultancy and partnership manager at the HousingLIN, and it's very much my pleasure to co-chair today's happy hour with Jeremy. And this one's a particularly important or happy one for us. So we're very delighted that each of our speakers could give up some of their time to be with us. Because the Supported Housing Regulatory Oversight Act, or SHROA as it's known, became law on the 29th of August 2023 and sets out a whole range of new duties and powers for local councils in England in relation to supported housing, and we really welcome the Act and its intention to provide regulation of the supported housing sector and a greater understanding of sort of supported housing that's needed across the UK, including some of those examples that Jeremy just highlighted. So this happy hour is very much focused on the range of responsibilities set out in the Act, including the requirement for councils to undertake an assessment of need for supported housing, and also kind of produce a supported housing 5-year plan. And we'll also touch on some of the sort of licensing arrangements for local councils potentially being proposed. I know Louise is going to talk a bit about that. So our great range of speakers. Our first speaker is Richard Loftman, who's a supported housing policy advisor at MHCLG, who's been very much part of the team responsible for setting out the responsibilities for local councils. He will give a very great overview of what the Act means for local authorities. And then we're really pleased to be joined by Adam Duerden, who's the head of service commissioning, living and ageing well. It's a very long title, Adam, nearly as long as Housing, Learning and Improvement Network, at Rochdale Borough Council, who's stepping in for Hayley Ashall, their Assistant Director of Commissioning Adult Social Care. And we worked very closely with Adam earlier this year to produce a supported housing needs assessment in Rochdale covering individuals with a range of adult social care needs. He's going to give an overview of that work and the impact that it's had in Rochdale. And lastly, we're joined by Louise Crook, who's partner at HCR Law, who's going to set out in a bit more detail the kind of legal implications of SHROA for local authorities from a kind of quality and licensing perspective. So really, many thanks to all our speakers and attendees for joining today. As Sally said, do post any questions in the Q&A box as we go along, ideally indicating who you'd like to respond to your question, just so we can kind of propose that to them at the end. And without further ado, I think I will hand over to Richard. Thank you very much.
Thank you, Lois. Hi everyone. It's really good to join the session this afternoon. So as Lois said, my name is Richard Loftman. I'm a supported housing policy advisor at the Ministry of Housing, Communities and Local Government. My presentation is going to give a brief update on where things currently are with the Supported Housing Act, and then cover in a bit more detail the new requirement as part of that legislation for local authorities to produce a supported housing strategy. So go to the next slide, please, Sally. So many people on the call will already be well aware, but I'll briefly just cover the background to the Supported Housing Act. So the legislation was brought forward as a private member's bill by Bob Blackman, was supported by the government and became law in 2023. It aims to address issues around some poor quality supported housing, where there's very little or no support being provided to residents, whilst landlords are charging high rents through housing benefit. As part of this issue, the government funded some pilots. So there were the supported housing oversight pilots, which were 5 local authorities. And then following that, there was this supported housing improvement programme, which is still ongoing at the moment. These programs, there was some really good work, and the local authorities were able to really make some good improvements on supported housing quality where there were issues. But they found that there were limits to what they could do without regulation. And especially the early supported housing oversight pilots kind of fed into the development of the legislation, and the supported housing improvement programme continues to inform kind of implementation and next steps on the Supported Housing Act. So the Act includes a number of measures. It enables national supported housing standards, which focus on the support services provided in supported housing, and that's the key current gap in regulation oversight, especially where services are non-commissioned. Enables local authority-led licensing schemes, which will allow enforcement against those national standards and the licensing conditions. There's a link for housing benefit entitlement to supported housing for licensing, and an advisory panel. Finally, there's the local supported housing strategies element, which I'll cover in more detail on the next slide. So again, as many people on the call will likely know and possibly responded to as well, there was a consultation earlier this year. It received almost 600 responses, and our team have been looking at that really carefully and working on some changes as a result. Importantly, to streamline the proposals, to make sure they're proportionate, to make sure they're targeted, and to simplify application processes to licensing. Importantly, to reduce burdens on local authorities to deliver this, and in turn for providers as well. The next steps, there'll be a government response to the consultation, which should be published early in the new year. There'll then be a second consultation on the detailed regulations, and we expect that to be around spring 2026. And ultimately, following these, we'd then be looking at the licensing regime going live in spring or summer 2027. But I should just say these timelines are a current estimate. They're not absolutely fixed, but that's hopefully a helpful kind of indication of next steps and timings. Finally, I mentioned the advisory panel, and this is to provide information and advice to the government about supported housing. That panel has now been established. There's 12 members on the panel. It's a really broad and diverse experience across the sector, including people with lived experience of supported housing. And that panel is going to be announced very soon. There's just a process at the moment of appointing a chair, and then you should hear more about that. So key thing to summarise from this slide: government response to the Supported Housing Act consultation is coming. In the new year, there'll be a second consultation on that detailed regulation. And like I said, there's a really big focus on getting that detail right, making sure it's proportionate and minimising that impact on good providers, who many are already providing really good quality services. In the meantime, the Local Government Association have published some interim guidance to help local authorities prepare for the Supported Housing Act implementation. And I think Sally's going to kindly share a link for that in the chat in case you haven't seen or come across that just yet. Next slide, please, Sally. So to focus in on the supported housing strategies part of the legislation, there's a new requirement on local housing authorities working with social service authorities to assess local supply and demand for supported housing in their area and publish a supported housing strategy. And this would be every 5 years, looking at supply and demand over the next 5 years. The government is going to publish guidance on this, and that's planned to be published in January, so very soon. The guidance is aiming to really provide a national framework for these local strategies, and it will consist of 4 components, which are set out on this slide, and I can give a brief overview of them. So starting with strategic priorities, the first component of the guidance, this is about the overarching vision and direction for supported housing in the local area. So importantly, I should say, there will be new burdens funding for local authorities to develop and coordinate their strategy. This will enable some strategic capacity resource, for example, a dedicated lead on a supported housing strategy in local authorities. We see, like, despite funding challenges in supported housing, which we'll all be aware of, this type of role and this local leadership we see can really make a big difference, coordinating the many teams that need to be involved in supported housing and partners as well, and making that case for supported housing locally, which can often be an investor save case. In terms of the scope, the minimum requirement is for the strategies to cover specified accommodation, and that's that housing benefit regulation definition. The guidance also strongly encourages that local authorities include sheltered or retirement housing where that doesn't meet the definition of specified accommodation. And then it will be for local areas to kind of decide and take forward whether they might want to bring in other forms of housing with care and support into their strategy whilst they're doing this. So, for example, looking at floating support services or shared lives scheme, or other types of housing with care and support as well. And this will, of course, depend on that local context and decision making and strategic priorities for that area, and of course what they might have a strategy on or not already. Secondly, partnerships. So this is about arrangements for effective collaboration and delivery. We know that partnerships are fundamental here, and I mentioned about that strategic lead and that kind of coordinating this and bringing the many partners together. And this partnership is really a common theme throughout the guidance. The guidance does set out a range of partners that should be involved, both within the council and externally, including health, integrated care boards, supported housing providers, and importantly, residents themselves. Governance arrangements should be determined by local authorities. So local areas may choose to embed this in existing structures where that makes sense for them. So, for example, health and wellbeing boards, housing strategy boards, or adult social care boards. While other local authorities may decide that a specific structure, such as a supported housing partnership board or delivery board, is right for them, or adopt a combination of these approaches. Thirdly, needs assessment. So this is a core part of the legislation. It's taking stock, understanding what supported housing is in the area currently, and then that future demand. So over the next 5 years, the guidance also encourages looking at a 10-year time horizon where appropriate or possible or practical to give that longer term view, but it's a minimum 5 years. Important to say that the guidance doesn't prescribe a methodology for the needs assessment. So it does outline an approach that the local authorities can follow, and sets out some evidence sources and some targeted outputs from that needs assessment. The evidence sources, as well as quantitative data, it's really strong on that qualitative evidence and intelligence from commissioners, from local services, and from residents. And this is really important about not only having the right amount of homes, but the right type of homes for supported housing in the area. And then fourth and finally is the delivery plan element. So this is about a plan for implementing the strategy alongside partners. The guidance sets out a range of considerations to support this, such as potential funding sources to consider, land and site considerations, and then other areas such as referral and move-on pathways and void management. We've included a range of case studies in the guidance from local authorities to highlight good practice examples, which are hopefully helpful. This section is ultimately about setting out delivery priorities and time-bound actions for those delivery priorities that will help shape supported housing services in the local area. So in terms of publishing the strategy, the plan is that regulations will be laid and will set a deadline for a requirement for the first strategy to be published by the 31st of March 2027. So that means from the point of guidance being published, local authorities will have around about 15 months to complete their first strategy. We heard a lot of feedback that kind of 12 months was the absolute minimum. So we've tried to kind of build on that a bit and have that 15 months timeline, which I appreciate will still be challenging, and there's a lot to do in that time. But hopefully that's something with the guidance helping that will be achievable. So finally, just to say on this, we want to use this opportunity to also help improve national data on supported housing. You may well be aware there is a lack of national data on supported housing, and therefore plan to request some management information from this. And this will really be some light touch reporting that just pulls out the key kind of information and data points from local authority strategies to build that national picture, and also help inform local authorities, see what other areas are doing, and help with things such as like benchmarking activities and things like that. So in terms of plan milestones, guidance on the strategy to be published in January, new burdens funding to be paid in February, and then that first strategy deadline is planned to be set in regulations for March 2027. And then from that point, once the first strategies are completed, there'll be kind of annual reporting from there as well that will be requested. So in summary, I think key things from this is there's a requirement for the needs assessment and to then publish a strategy. There will be new burdens funding for this, paid for LA capacity to develop and coordinate the strategy, and importantly that guidance is going to be there from January. So I think that's it from me, and I'll pass back to Lois.
Brill. Thanks so much, Richard. That was a really great overview. Yeah, I really appreciate you giving the time, and I can see there's already a few questions coming through that we'll have time to kind of chew through at the end. So thanks everyone for your questions so far. Going to hand over to Adam now. So an example of a local authority that's already kind of perhaps a little bit further ahead and has started doing some of this work in relation to the needs of their local communities. So Adam, thanks for joining us. I'll hand over to you.
There we go. Thank you. Hopefully that's popped up now. Oh, and I'm on the screen as well. Oh, that's a bit disconcerting. There we go. So yeah, thanks, Lewis. As she says, I'm head of commissioning with Rochdale Council in adult social care. Primarily looking at living and aging well, so kind of mainly portfolio around older adults and people with physical disabilities. There's my equivalent as well, Barbara, who supports around working age adults. And obviously there's Hayley there, who's the AD who hoped to be with us today, but unfortunately can't make it. So moving on. So where we are as a local authority in social care, we have a statutory duty to understand the needs of the residents within our borough of Rochdale, and really understand the direction of travel, population, demographics, and really kind of produce something that lets providers, whether that's housing providers, social care providers, understand what those needs are so they can react and provide support appropriately in the communities. And to do that, we designed something called market position statement, which is mentioned within the Care Act as a good way to meet those needs. The previous market position statement was launched in 2020, So that would have been based off 2011 census data, and as updated by official national statistics. I think the latest update was 2018. So kind of what we're working there is up-to-date information with the new 2021 data, people's needs, how they spend, how they want to live has changed as well over that time. Particularly, we've had that, I don't know if everybody remembers, a certain thing that happened over a couple of years, COVID. People's kind of responses to that have changed, what people want to do. So we have Public Health, they release a joint strategic needs assessment, the JSNA. There is some intelligence there, this new kind of census data. We needed to pull all that together really and have some expertise to help us understand what kind of people, how we could meet those people's needs and what they wanted to be. We need to listen to those people as well in our communities. So that's where HousingLIN really came in, and with that kind of understanding need of specialist housing and being able to pull all that data together, both the hard kind of facts and the figures, but also some of the softer data around speaking to communities and our providers and the markets to really co-produce what is it that we need to move to on a more strategic basis. How they understood how local government works and how our providers and markets works, what supported living was, and then bringing into that, it's not just supported accommodation, it's care homes, extra care, all the kind of thing that fits under that supported accommodation umbrella. That robust evidence that came forward then, that was provided in this really lengthy, helpful document that was produced, was really robust to help us to plan for the future, saying, well, what are our gaps, what are our need, what's that demand going to look like? And from that, we've produced the strategic housing strategy and local plan into which there's links in this presentation, which I understand will be shared. And that kind of started 2024 with a review 2025, but that looks way into the future, going in 20 years into 2044. We looked at different, we'll say, groups of different types of people and different needs, whether it's older adults, working age adults with learning disability, older children, teens that might move into adult social care, people, autistic people, people with mental health needs, as I say, people with physical disabilities and long-term health conditions, which will require additional support from social care and housing to meet that need. So some of the methodology that was used was bringing in that JSNA. The link to Rochdale's is there as well, so you can click on that once you get this slide deck. Analysis of all that data set. Looking at what we currently had in terms of housing stock and specialist support. Lots of provider stakeholder engagement, whether that's council officers or health, NHS staff, public health, strategic housing, adults and children's social care, supported housing providers, care providers, and our co-production network. So that's people with need who can give information around what they want for the future. Reviewing areas of good practice across the country that we, so in Rochdale we'll know a little bubble and a little place around it, but what else is out there that we can learn from and get go. From that we had a great then assessment of that need, looking at what specialist housing, supported living that we would need to have now over the next 20 years. From that assessment, we're able then to produce our market position statements. So breaking it down into those different categories, of which we're then able to kind of really project that demand, really make outline to providers. So that, as I say, that's housing providers and social care providers to kind of start developing their own services and provision within the Borough of Rochdale. Allows the voluntary sector to respond to need in the communities, and by having those experts' experience, they can see what and understand how they fit into that kind of area of social care and housing, and how they will say, well, this is the direction of travel. How the carers hub, for instance, can respond to some of that need, how advocacy providers can, and other health and social care professionals can understand that we are trying to do what we can to support them now and into the future. So these are the different market position statements for each different sector that we've managed to produce using this data. So it's really tailored to different sectors that will provide that support. And again, the links there to them also, you can have a read through at your own time if you really want to. So what does that mean now about now having these really comprehensive market position statements? Well, we've got a better relationship, I think, now with our housing providers and potential housing providers as well. And also our care market has a clear understanding of direction. You know, we've been told time and time again that people don't want to live in care homes, for example. So how can we help support people to live at home or live more independently? You know, whether that's more extra care for those gaps that we're seeing as our aging population increases at a much faster rate than our working age population. How do we help support that older population into the future? So already we've got new dashboards and data really to help us map some of this information that we can then start utilising in commissioning of new services. We've already got on the cards now on the back of this new mental health provision to support people go back into the community in the more simplified way that helps meet their needs to make more of a success of living long-term in the community. We've got new complex learning disabilities and autism flats and bungalows coming online soon. We've been speaking to developers around extra care and bringing more extra care into the borough. We have new nursing, complex nursing, dementia nursing, also in the similar conversations, and more services for mental health, learning disability and autism as well. So it's really kind of accelerated those conversations that we're able to have with developers. But by having these, it means that these market position statements, developers are able to go out for investments and bring that investment and demonstrate to those people providing those loans, whether it's pension bodies or whether it's a bank, however they're going to for that capital, they've got evidence to support that bid for that capital. And now we've also then used these as platforms to go on and do our strategies around mental health, autism and learning disabilities, and really kind of start that conversation about doing things differently. So we've got the care home tender for our new care home contract going out, which is looking at how we can make what is a really traditional kind of care setting into something that's a little bit more modern and helpful and enablement focused to support people into the future with more complex needs. I think that is the end.
Real. Thanks so much, Adam. Yeah, really appreciate you taking the time and showing us kind of the particularly kind of the impact it's had on you being able to kind of engage with the market, and particularly those examples that you raised at the end there, the actual real life kind of buildings for people to move into. So thanks very much for that. Okay, I'm gonna not hesitate and move on to Louise, who's going to give her presentation. Thanks very much, Louise.
Hi everyone, I'm Louise Crook from HCR Law. We're a full service law firm, but I'm head of the healthcare team, and within the healthcare team sits a lot of lawyers who do various different bits and pieces, including what we call our housing with care section, which is effectively acting for all different types of providers within this supported accommodation field, and that includes housing providers. We act for a number of housing providers, care providers, and also developers. So it's been really interesting for me today to listen to what the other speakers have had to say about their interest in the chain, because I come from very much the commercial side of the transactions, the people who are on the ground trying to pull these things together. My slides will go over actually a few of the things that have already been discussed, particularly by Richard, who's actually described the Act and the changes far better than perhaps I could. So I'll probably skip through some of that more quickly, and I guess you'll understand why, so that I can move on to discuss some of the more practical elements, the things we see day to day, and how I tie that in with some of the things that that Richard and Adam have been talking about. I'm also going to just bring in another piece of legislation that's being discussed at the moment, the English Devolution and Community Empowerment Bill. You'll wonder why. It's because it crosses over with the Supported Housing Regulatory Oversight Act in terms of how it impacts on leases and leasehold drafting, and what housing providers and developers and investors. It was good to hear Adam talk about investors at the end. Will be looking at when they look at these leases and the investment value in these leases. If we just sort of go through these initial bits very quickly, because I think Richard has explained very much where we are in terms of the Act, its purpose, what it was set up to do, and where it sits now. It was, as he said, quite rightly introduced for the purposes of trying to address that problem of problematic housing provision and some of the disasters that we've seen over the last decade. And I've been working in the supported accommodation field for more than a decade now, and there are particular providers that we've seen on Panorama. There are particular investors that we've seen in the stock market that have given some of the provision in this sector a really bad name. And I think some people I've heard refer to it as the Wild West of supported accommodation, where people have played fast and loose with effectively money that they've received through the housing benefit system in order to try and create housing that isn't up to the right standard. It's clear there are some of those providers. I've just given you some examples, but there are also, and I work with, some excellent providers of housing and care and support, and some excellent developers who aren't just about the profit. Obviously, they're in for profit. They're not registered charities. That's where my care providers and housing providers are, but they are people who care about providing a product which is really good quality and fit for purpose. So Richard took you through the key proposed changes, and we'll see how those will impact on transactions as we go through this process. The advisory panel he spoke about, and the standards. When we come to look at the standards, we'll have to work that through our leases into who's going to be responsible for those. There's many stakeholders, as both of our speakers have talked about in these transactions. That's what makes them so difficult to pull together. But these transactions are never straightforward, because you need to be working with local authorities who are commissioning the care, the housing providers who are providing the spec and the housing, the care providers who will be providing the support into the scheme, the investors who are looking for a return. And all of these people need to come together at once to provide a product for essentially vulnerable people who will get better outcomes as a result. And I think that is what keeps people motivated, as we sometimes feel like we're pushing treacle uphill in order to get a scheme completed. So what we don't want with, say, something like the licensing schemes is to impact negatively on those providers who are already providing really good housing and care and support with specialist supported housing and or supported accommodation, to find that they have to face increased regulatory burdens, or in fact that schemes that are already in payment don't have to come out of payment or suffer as a consequence of some of this new legislation. And that's something I think we need to be really mindful of. Adam talked a lot about the planning, and I think that is going to be broadly welcomed. He talked about that improving the engagement with the providers going forward, and that can only be a good thing, because it's the lack of transparency and the lack of understanding of where the need is that can sometimes be a bar to getting good schemes in the right place at the right time, to enable vulnerable people who require the accommodation to move out of institutions and into schemes which almost always provide better outcomes. So I talked generally about the impact on the lease. The repair clauses within the lease will need to be looked at carefully, and also in the commercial agreements between the housing provider and the care provider. We need to make sure that the standard of repair that's being required by the national standards is reflected through these agreements and picked up in the right place. The specific licensing obligations, the operator will need to be licensed, presumably. So what happens if they lose their license? What impact will that have on the leases? Will we need to think about putting more break clauses into the leases? Should these be extended further to incorporate some of the things that are coming through in statute? And what impact will that have on investment values if people are feeling unsure about whether or not leases can be sustained over a long period to create that investment value? And then we'll need to think about putting landlord warranties into the leases to ensure that the landlords are providing the right information to the tenant housing providers so that they can comply with the licensing agreements as they're imposed by the local authority schemes, or whatever schemes come through. I mentioned that I would say quickly about this English Devolution and Community Empowerment Bill, and the only reason that I mentioned that is because it will impact on supported accommodation leases. It is for commercial leases, so you think, why is it going to impact? Well, the housing providers take a lease from the landlord, and that lease is viewed as a commercial lease. It falls within the Landlord and Tenant Act 1954. A lot of you will presumably be familiar with that. And so that means that the impact of the changes to rent review will be seen impacting on these leases. So if it brings in its key proposed changes of ban on upwards only rent reviews, where the lease is a new lease or a renewal of an existing lease, then that will impact on supported living leases, which are generally upward only rent reviews based on RPI or CPI, because the housing benefit increases every year. And this is what can make those leases sustainable over a period and then attractive to other investors, whether that be debt funders or equity funders. So if the impact on the lease will be that the rent review mechanisms will change significantly, and again that will have an impact on that investment value. It's too early to say whether that's going to be the case, but it's worth bearing in mind when you think about all of these competing forces on the supported accommodation lease and the environment with which it sits. So just to move on to those practical implications that I mentioned at the beginning, having sort of cantered through those bits, I think the strategic oversight and data-driven planning to give us a more coherent planning supply will be broadly welcomed by everyone. It will allow us as Adam spoke about, to engage earlier with commissioners in order to talk about that clear understanding of direction, and he said investment, evidence of support. If we can get that evidence of support through these transactions, because there's this data-driven requirement for supported accommodation, I think it will make it a lot easier for people. The other practical implication that I hinted at earlier was there's a risk to the supply of this housing if the regulation becomes overly burdensome. I mentioned excellent housing and care providers that are already working in this sector, already struggling to pull schemes together. We don't want to put any of that at risk. The objective of improved quality and safety of supported housing is always welcomed, and I think will be broadly welcomed across the spectrum. And it won't probably be much more different to what a lot of housing providers are already putting in place. And more clarity on conditions, support levels, and residents' rights again will be broadly welcomed, and we can push that through the documents to make sure that the right commercial agreements contain the right obligations on people, and that can only be a good thing for investment going forward. That's probably all I have to say on those practical implications. There's a huge amount more. Obviously, you'll all understand, if you've ever tried to pull together a supported accommodation scheme, how difficult it can be to get everybody in the right place at the right time. So anything that improves that is always going to be welcome.
Cool. Thanks so much, Louise, and thanks to everybody for speaking, and also for those of you that have put questions and comments throughout this webinar. We really appreciate it. I'm conscious we've got quite a few questions and not that much time to kind of complete all of them, but I have tried a bit to kind of group some of the questions together as we've been sort of speaking. So I think there are a few questions that are potentially directed to yourself, Richard, around kind of licensing and new burdens funding. Perhaps we might be able to start on initially, and appreciate you might not be able to kind of respond to each of them, but in terms of if we start with the sort of licensing requirements, I guess the first one is around kind of whether MHCLG has a view as to where that should sit within local authorities. Somebody's also asked whether there's thought about kind of whether people might need to be upskilled within local authorities in terms of undertaking some of those requirements. So I don't know whether you've got a view at this stage around kind of licensing and kind of where that should sit in terms of departments, also kind of where there might be two-tier authorities as well.
Yeah, so the licensing will sit in the local housing authority. That's where the power is. However, it will be up to local authority to decide if they would want to have a licensing scheme with partners, so neighbouring authorities, or run a licensing scheme as a county, for instance, in two-tier areas. So within the council itself, it will be a multidisciplinary team. There's been a lot of learnings from the supported housing oversight pilots, which I mentioned, and there's some best practice guidance that was published from that. And then, like I mentioned, the supported housing improvement programme, which is being evaluated, and that evaluation is due to be published in the new year as well. A lot of learnings on that. But essentially, these are multidisciplinary teams that are needed. And then linked to that, I should say, we're looking at new burdens for preparing for licensing and getting set up, and then there'll be fees that would then be able to fund the necessary resources to run the licensing scheme on an ongoing basis.
Brill, thank you. That's helpful. That kind of leads me on to another question that was posed, was whether the funding would be just used towards the kind of the sort of licensing requirements, but also potentially towards that kind of strategy and needs assessment work as well, whether there was funding that potentially be available to across the board for all of the kind of new powers and responsibilities that local authorities will need to undertake.
Yeah, that's right. So the new burdens funding that I mentioned in the presentation in February, that's just for the strategies element. And then to follow on from that, there's an ongoing new burdens assessment about the licensing costs as well.
Fab. Thank you. And I think the sort of last one that's kind of cropped up a bit is around whether you've got any kind of indication about how that might be kind of disaggregated by kind of areas. Yeah, where, we've got different geographic areas and size of local authorities in terms of funding for new burdens funding.
Yeah, so that's definitely being thought about. I can't share any detail on the new burdens funding allocations at the moment, I'm afraid, which I appreciate is probably quite frustrating. But yeah, that is coming in February for the strategies, and then there's ongoing work on the licensing side, and that will be announced at some point as well.
Real, thank you. I might come back to Richard in a minute, but I'm conscious Adam, you need to leave in by 5 in order to get a train. So I thought we'd try and capture you some questions that are more targeted towards yourself.
Yeah.
In the chat, and some of them might be a kind of mixture of us, and I know Ian's on the call to kind of answer some of those. But one is around I guess, translating, how we kind of translated data on the number of people with particular needs into, that are eligible for different kind of adult social care needs into, what that actually means, I guess, in practice in terms of, the kind of number of homes required. And obviously, the report that we kind of published together is obviously available in terms of the sort of methodologies and things kind of taken. But I don't know whether you've got sort of anything you want to add on that, or whether
it's mainly your brain that I think was it was looking at that data, and we helped interpret that together. But I think that's probably something you could probably answer a bit better.
So it was very much a kind of collaborative approach, and I think maybe it's worth mentioning that in the kind of methodology used for different groups, and I know it's a bit clunky to put people into groups, was kind of different across different cohorts. So for the older persons, we were looking at the kind of need for accommodation for older persons. Very much that's kind of an approach that we received some funding from the HRI, and we've got it to do a kind of survey of 6,000 people over the age of 50, so around their housing preferences in later life and their kind of needs in later life in relation to housing. So the kind of section around older people is very much driven on the kind of data, the evidence that comes from the survey that we undertook with older people across the UK. And then in relation to kind of those with kind of more eligible care needs, that's kind of very much kind of mining local data around kind of primary support needs and kind of what the trend of that has looked like over the kind of past few years, as well as kind of thinking about, what some of the assumptions we might make around kind of how we would like that to look, whether that's around kind of diverting people away from residential care into kind of more kind of mainstream style accommodation or supported living accommodations as well. So very slightly different kind of approach, but obviously a very kind of collaborative approach to that, using kind of your kind of local data as much as the kind of what's available publicly. But I don't know whether Jeremy, have you seen any other questions for Adam just before we leave?
I don't think I've seen anything specifically for Adam. I think Claire Asprey had a question about translating that data, which I think you've covered already, but also about thinking about that over different timelines as well. Adam, I don't know whether you want to, if there's anything you can share with us around that timeline.
I suppose what we had is obviously the big document that you produced, and that covered all types of accommodation, whether it's sheltered or whether it's what people will need for people with physical needs, how we need to have appropriate accommodation to meet physical disabilities and things like that in the borough. And then what we've been able to do is distill that down into the 6 different market position statements to say, so as Lewis said, they're around, so we've got cohorts of, like, so for older people, we can look and go, right, okay, our older population is going to increase by 30% over the next, I can't remember if it was 5-10 years. And how do we meet that demand? Because that's going to need more support. So it's more focused towards social care than these market position statements. And then that would say that, well, if we did nothing differently, we would actually need a lot more residential homes. But then the intelligence is that people don't want to go into residential homes. So what do we need to do to meet that requirement, really? And that's building different things like extra care, making sure that any future housing stock is going to be easily adaptable, be able to people to live there long term. And I did see a question around extra care as well, actually, that said that will people be able to stay there when their needs change? And yes, that is the intent of extra care. And that's the beauty of intent of extra care, is that it has a mix of need. So you have people with just general needs, DRI, just might be over the age of 55. And then you've got people right on the other end where it might be more complex needs, might need personal care being delivered quite on a regular basis throughout the day. But that's, because you've got on-site care provided, they're able to support people quite well with that and that progression. So it's almost like future proofing for some people, that they think I can live there comfortably now, rest of my life. Now, there will be people where it is more complex. You don't know where someone's dementia journey might take them, or clinical needs might take them. There might be a nursing requirement, in which case then we might need to look for different things for people. But being able to future-proof is really the whole point of what we're trying to look at around social care.
Well, thanks for that, Adam. I think if I may just squeeze one more in before you go, there's a really great question from Jane about the relationships with you in terms of out-of-hours placements and the role of the ICBs, but also the link between revenue and looking at capital, both in terms of service improvements, but also access to Homes England grant for the new social and affordable homes programme. So again, thinking about that continuous market engagement, how it links in with that.
It is. I mean, when we launched the market statements, we did a big event to kind of kickstart that, and that's where a lot of developers now come to us and talk to us. And I think what's really useful for developers is those market position statements, because you can quote them directly. You could put them in a pack. You can say, this is what the need is. It's there in black and white. This is what the council's telling us that they need to meet future need. So this scheme that we've developed will meet this by doing X, Y, and Z. It's quite straightforward, makes it a lot easier to interpret what the future is going to look like.
Well, thanks very much, Adam. And I know you need to shoot. And I think there's a few questions for Louise as well. We can just sort of bring you in if we can as well. I think one around things about charging service charges, our fees, some of the fees, will they be service chargeable? Or Richard, I think there's a question for you possibly as well. And I know several people are saying, can you let us know who these excellent providers are as well? That may be something offline, but if there are any things that you want to respond to, please do.
The service charge is probably, I think that's a reference to the service charge in the housing benefit claim, I imagine, and that's usually pulled together by the housing providers. Then maybe that's a question for Richard or Adam more than it is for me, but that's an assessment of what all of the costs are going to be in providing care in order to get the commissioner support, which is the start of any scheme. You look at where the scheme is and what the requirement is, and then what the housing benefit payments would be. Once that commissioner support comes through, then care providers and housing providers can start pulling that together. So I don't know if that answers the question, but that's my thought about supported accommodation and service charge. If we're talking about service charges on other things like extra care schemes, a different question, then that's obviously a different kettle of fish.
Any further comments from the panel on that? Or Ian, have you got any comments that you want to raise on this?
There's an awful lot of comments here. One thing perhaps is we'll take these away, these questions, and perhaps circulate them to panel members. No obligation that you have to answer them, but if you can and get back to us and we can circulate them, that would be great. I think a couple of questions for Richard. There's a couple of questions on here. One, a general theme is how much flexibility will local authorities have in terms of undertaking needs assessment, producing the strategy, implementing the licensing arrangements, how much of that will be completely prescribed by government and how much will be left to local authorities to exercise discretion to meet their kind of local circumstances. And then there was another question in there, very apposite one, about local government reorganisation in those two-tier areas where they're, particularly where they're in the early wave of that, then that hits the deadline for producing the strategy in a year's time when they may well all be completely different. So if you can provide any thoughts on that, that'd be very helpful.
Yeah, thank you. So, yeah, both really good questions. So, in terms of like the strategies, it's definitely got a lot of flexibility. The guidance sets out a framework, and it has some minimum requirements, but there's a lot of flexibility, and that's by design. Local areas, of course, know best on this, and also local areas are coming in from different positions. The aim of this isn't to undo any existing strategic planning or needs assessment work, but to build on that or to build on related strategies. Obviously, supported housing cuts across adult social care, housing, many other areas. And it's really about linking in with those strategies and needs assessments, building on them with a focus on supported housing. And in turn, that then informing those wider strategies as well in turn. So a lot of flexibility. As you'll see in the guidance, it's not very prescriptive, but hopefully lays out a really helpful framework. Licensing work is ongoing. So in terms of like things like licensing conditions and things like that, that's more of a national approach. And there was a lot more information on that in the consultation. But as I said, that's we've been really looking, our team's really been looking at streamlining that and making sure it's proportionate, and more information will come in the government response on that. On local government reorganisation, so like this is recognised in the strategies guidance. Like it's something that, so the strategies guidance encourages, if where possible, where appropriate, to kind of get ahead on that. And if this is something that can be produced as a new proposed unitary, or at the very least, if this is something that those conversations take place, so when they come together, those district strategies talk to each other better. And of course, this will be for local authorities to decide what is possible there. But we appreciate that adds a layer of complexity, and there is some information set out in the guidance about it. But it's really an ask about, is this something that maybe you can come together early on and get a head start on this particular area as a new requirement. So something to think about there.
Brilliant. Thanks, Richard. Okay, we are about 1 minute to 5, but it feels like we probably could have had 2 hours talking about this with all the questions that we've had. So just want to kind of round up from my side before I hand over to Jeremy around next week's happy hours, just to say a massive thank you to all of our speakers. Appreciate Adam's had to jump off the call for the time you've given today. And yeah, as I think the slides will definitely be available after this. They'll probably be uploaded sort of tomorrow or in the following week. But yeah, all these questions, as well as Ian said, we'll try and kind of share and see if speakers are able to kind of provide a response. But thank you very much for giving your time, Jeremy.
Yeah, I can echo that, Lois. Thanks, everybody. If this is the first time that you've joined us for our happy hour, we normally run these every Tuesday afternoon. We've got a few more before the end of this calendar year, but we're sneaking an additional one in on Thursday morning, looking at AI and data. Data has already come up in the conversation this evening, so please do join us again if you wish to on Tuesday morning at 10 o'clock. And then next week we're holding a happy hour in partnership with the Dementia and Housing Working Group, looking at different aspects of dementia-friendly homes, accessibility, adaptability, and how to become a dementia-friendly organisation. And our final happy hour is taking place on Happy Awareness Week, the week of the 15th of December. I think it's on the 16th of December, Sally, if I'm right. So please do join us then, when we'll also be joined by Stephen Witherford, the Sterling Prize winning architect of this year's Appleby Blue. So we've got lots to look forward to. Can I thank all our guest speakers this afternoon, and Sally and the team behind the scenes who've done a fantastic job to put this session on. Thanks ever so, and I wish you a happy evening.
Thanks, everyone. Bye.